solidarity, guys.
It's great to be here in Toronto today to say that we're public employees. We believe in public services, public Medicare, public long-term care, public home care, and the citizens of Ontario deserve better from the government of Ontario. Citizens that need our care each and every day. It is unfathomable in 2010 in Canada that our system would call a senior in a hospital bed a bed blocker and kick her out of the hospital. That's not right. We don't accept underfunding of Medicare, the commercialization of home care, the privatization of long-term care, and all across this province, we've seen nothing but cutbacks. In Scarborough, in Sudbury, in Peterborough. And we're not going to confine ourselves to speaking only to the McGuinty government, to the Harper government. It's time to renew the healthcare accords. Don't talk to us about deficits or the need for tax cuts. The people of Canada expect the government of Canada to offer up our taxes, to make Medicare, to make long-term care, to make a better system, long-term care, and to defend home care. We won't back down! 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 We won't back down!
We have Arlene Patterson, co-chair of the Sarnia-Lambton Health Coalition.
I bring greetings from Sarnia-Lambton Health Coalition. We've just celebrated our 10th anniversary and fighting back on hospital cuts and threatening our health. I also bring a message from Barb, who is a senior citizen in our community, who fell and broke her hip. She was in hospital after hip surgery for 3 days. She was then forced to go to a retirement home for convalescents. She ended up staying there for 6 weeks, and it cost her over $4,000 for the care that she did not receive in a retirement home. She got physiotherapy twice a week, which then delayed her full recovery. She went back home with no occupational therapy assessment, and she ended up falling again, breaking the same hip. Here we are back again. And please remember the Barbs when you're out there fighting the fight. Hospital cuts do threaten our health. Thank you.
Thank you, Arlene. Next up, we have Sharon Richer, VP of OT.
I bring greetings from Northern Ontario. I'm from Sudbury. On Wednesday, we had our own rally in Sudbury. November the 5th, the hospital came to us and told us that they are closing 130 beds. All of these beds are at a memorial site, and it's the ACL. All of these patients will be moved to a private nursing home. And they will be, some of them will be moved to an extended care in Pioneer Manor. The problem with this is we have 500 of our seniors who are waiting for a nursing home in Sudbury who are unable to get a placement. We are very afraid that the people at the hospital, once they close the doors March 5th, they will have to go to other areas of our community and to outlying cities. We are here today to help with hospital cuts. We support everybody across the province who is in the same fight we're in. Don't give up, keep fighting, make rallies, do postcards, move on, help OCHU, get the message to the government. Thank you.
Next up, we have Kelly O'Sullivan, CUPE Home Care Rep.
Hello, sisters and brothers. My name is Kelly O'Sullivan, and I'm proud to be your elected rep for home care in the province of Ontario. And I'm proud of that because home care is health care, just like long-term care and just like hospitals. We're all part of the health care system that keeps our province healthy. Now, the health minister likes to claim that hospital service cuts, the money saved, has gone into supporting home care.
Lies! Lies!
Well, if you ask a PSW, like the sister over there, Patricia, hello sister, one of the frontline care workers who provides the personal care, bed transfers, meal prep that our seniors need to live with independence and dignity in their homes, she'll tell you that she is doing more for less.
That's right!
If you ask those of us that have worked in home care over the years about all this great funding that they took from hospitals and put into home care, we'll tell you we haven't seen it.
No.
We haven't seen it at all. What's happened since the Liberals got into government is they continued the competitive bidding model. That puts home care up for sale every few years.
We're not for sale!
And creates chaos and uncertainty. And guess what else it created? It created the for-profits coming in and storming in to get the money. And guess what else it created? The cost of services actually went up. And you know why those costs went up? Because of for-profits. They're going to get their profit from somewhere, and they get it from home care instead of the money going into the services that are needed.
Our next speaker is Brother Michael Hurley, the President of
Thank you very much, sisters and brothers. Thank you for traveling so far. Some of you, it's 13 hours on the bus to be here for this rally, and you're here because of your compassion for the people you care for every day, and your compassion for the seniors for whom this rally has been called. Since 1990, this ministry has closed 19,000 hospital beds in Ontario. 19,000. And as a result, our hospitals are working at overcapacity, they're crowded, and this government is pushing people out every day who are too sick to be sent home. This rally is for Alice McPherson, 90 years old in Windsor, dying, 2 months to live. She has congestive heart failure. She has diabetes. She has arteriosclerosis. Her hospital has told her they want her out of there. They need the bed. She's a bed blocker. This rally is for Alice McPherson.
It might come as no surprise to you that the only organization, the only stakeholder who opposed our call for 3.5 hours of care was the for-profit Nursing Home Association. And you might also be interested to know that over 50% of the beds in this province are owned and operated for-profit. Profiteers siphoning money right off the top of these envelopes into their pockets while residents have to wait and fight. They have to fight for 2 bags of
future, sisters and brothers. I want to talk to you about 10 months from now. 10 months from now, we are in a provincial election.
Yes!
And we must demand of every party running in this election that they release their platform now. That they talk about how they're going to invest in healthcare now. How they're going to stop hospital cuts. How they're going to have hours of care in long-term care. How they're going to remove competitive bidding from home care. How they're going to stop the profiteers from making money on our sick and our seniors. It's wrong, sisters and brothers. It's just wrong. That we're here today on this coldest of all bloody days. Because we're standing up for seniors, goddammit, who deserve respect in our province.
On behalf of Providence Center and Local 1590, I want to thank each and every one of you for coming today.